This conference will now be recorded.
HRA EDA Lunch and Learn. And friends, we like to do this once a month, kind of a standing event on the second Wednesday of every month. We bring in a different speaker, a different topic on each month on a variety of things. We kind of try to focus towards what our business community might like. So if you've got any great ideas, by all means, let us know, because we want to be reflecting the needs of the business community. To make a long story short, this month we're talking COVID-19. So COVID's been around for what, give or take 2.5 years, plus or minus, and the situation has changed. The best guidance from the medical community has changed multiple times. So knowing in my own personal life, when family and friends come down with COVID, it's like, okay, what do we do? Well, I remember what the initial conversation was and guidance was, but that's changed and that's morphed. So we kind of want to check in here today with our professionals from Renville County Public Health, Stacy Larson, as well as Lisa Ninekins, who's the county's HR person, to talk a little bit about what the latest guidance is. I will mention, and I apologize, I forgot to send it out, but they come out with, I don't want to say best practices, but best practices, kind of an update, what the guidance looks like. And that gets updated from time to time as guidance comes out. So I will email that out to everybody on our email distribution list, as well as put it on our social media accounts here in the next couple days with a link that you can go see the Renville County Public Health website. As those guidance are updated, you can get the freshest version too. I do want to mention as well that this event or this little session is being recorded, not for any nefarious purposes, but simply for those who aren't able to make it here over the noon hour, that they can pop in and catch that at their convenience. So this will be eventually posted on our Facebook, LinkedIn, and Twitter pages, as well as our website, renville.com. So if you miss something, you want to go back to it. And honestly, there's probably people saying COVID, not an issue right now. Okay, but maybe in 2 weeks, a month, it might be an issue. So that's why we're doing it. So friends, we have some distinguished speakers here today. We have Stacy Larson, Olivia native, and she has a BA in nursing from Gustavus Adolphus. She's worked for Renville County Public Health for 22 years, so that means she started when she was in the 4th grade. She's part of our adult health team and does home care visits and case management and conducts Minnesota Choice assessments. Stacy was involved with the COVID-19 response. I remember helping volunteer for the vaccination clinics. And friends, if you see her on the street, just call her Viper Commander, because that's her code name. So we'll turn it over to Stacy here in a moment. Also want to introduce Lisa Ninekins, who is our HR guru here at Renville County, a native of the flowing metropolis of Sacred Heart. She's all around good egg. She does a lot of human resources type issues here, including employee benefits training, employee labor relations, county policy administration, and that kind of stuff. Lisa has a bachelor's degree in ag education and a master's in education, and is Society of Human Resource Management certified. So with that, I think today we kind of talked about maybe kind of making this a little more informal, more conversation type. So if anybody has any questions, if it's okay, you can put it in the chat box, or if you something pressing and you don't, not the best typer, you want to bring it up, just unmute, and if you don't mind popping off your screen so we can see a little bit as you chat. But if we can do some, as they come up, and then maybe kind of a general Q&A at the end, if that's okay with you, ladies.
Works
awesome.
For me. Works
awesome.
for me.
So Stacy, why don't we kind of start with you? You and I were chatting yesterday, and oh, how the world has changed in the past 2.5 odd years.
Yes, definitely. So like Jordan had said, we've come a long way with COVID. Lots of changes in the last 2 years. I don't want people to, I don't want to be a Debbie Downer, but COVID is here to stay. I mean, we're not going to get away from it. We are just going to have to learn how to live with it, and in the workforce, how to work around that or live with it at work. So mostly what I'm going to go over is just basic our kind of updated isolation and quarantine guidelines. Like Jordan said, he will also send that out. There'll be contact information, so you're certainly able to send an email to public health if you want that sent out to you, or if you have any questions. But I also want to reiterate that we're beyond panic mode. So if somebody in your office gets sick with COVID, we don't need to rise up to the level of panic, and give ourselves grace and not probably make that person feel like they're wearing the letter A, if any of you know about the scarlet letter, the letter A on them. But COVID is, I don't disregard that it is a serious virus. People can still get seriously ill, hospitalized, and die. But we have come a long way with vaccinations, treatments. We better understand how to manage the virus. And so I just want to give some points to that. So Steph, if you want to bring up my PowerPoint, I am not tech literate.
But Steph is, so it's a good thing we got her.
That is so true. And like Jordan said, this is very casual. So if you have a question about any of this, like isolation and quarantine, because this has changed so many times. So at Public Health, we're constantly updating our guidance. Our guidance comes from MDH. So CDC will come out with new guidance. We wait for MDH to adopt it, and then we update ours, and we try to make it very user-friendly. So
and
that
MDH is the Minnesota Department of Health.
Yes, and we try to make it really user-friendly so that if anybody would become ill, they can really pretty much just follow whichever column they're in. So just to start, if you have someone in your business, say you have someone who calls and says, I'm not feeling well, I tested positive for COVID, and then you're thinking, okay, now what do we do? So that individual needs to stay home for 5 days, and it doesn't matter if they're vaccinated or not. So the day 0 is the day they tested or the day their symptoms started, so whichever one comes later. So say, for instance, I started to not feel well on Monday, but I didn't test on Monday, but then I decided on Wednesday I was really feeling rotten, so I tested on Wednesday and was positive on Wednesday. Wednesday's my day 0. So then I count 5 days from that day, and I need to stay home. I really need to isolate away, even from my own family members, wear a mask in the home. Obviously, we all know it's not always possible to isolate from, young children in your home, but try to isolate as much as they can. After 5 days, if the individual is feeling better, they don't have a fever for 24 hours, they maybe don't have a sore throat, the body aches, they could return to work, but they would need to mask for 5 more days. So they could return to work, they could go to the grocery store, they could be out in the community, but should mask for 5 more days. If you were not feeling well after day 5, you still were feeling rotten, had a fever, really sore throat, really loose cough, aches, just generally felt rotten, you need to stay home for at least another additional 5 days or until really those symptoms subside. So it could be longer than 10 days, depends on how ill you are. If at any time within that, let's say you tested positive for COVID, but you really don't have any symptoms, you still need to stay home for that 5 days. If at any time in that 5 days you would develop any symptoms, then you're back to day 0 again. So it's kind of like moving the peg forward and hoping you keep moving forward, and you don't move backwards. So I don't know if anyone has any questions on that, on like isolating. You want to stay away from people. The other thing I really want to reiterate is if people do not feel well, do not come to work. This is not the time to be the hero. If you aren't feeling well, just stay home. And if you have symptoms of COVID, it's not like a plague to test. The tests are available anywhere. You test, then because the issue we run into is people won't feel well, and then they're afraid to test, and then like 2 days later, they're like, well, I kind of feel better, I'll come back to work. And they actually have COVID, and the next thing you know, their next door cubicle mate now gets sick, and then on and on and on, and pretty soon you've wiped out your whole office. So it's really better to know what you're dealing with than what you're not dealing with. Anyone have any comments, questions on that?
Stacy, we've had people ask, they've said, like, I've had this chronic cough for 2 weeks. So I still have this cough. So I
Yes.
still have a symptom, but I haven't had a fever. Can I come back?
Right. Okay, that's a really good point, Lisa. So there's a difference between I feel symptoms of COVID and side effects of COVID. The symptom to me would be like a fever, body aches. A cough to me would be if it's a loose, harsh cough, like you're bringing up colored phlegm. Many people following COVID will have kind of a dry cough for 2, 3, 4 weeks, even 2, 3, 4 months. I had COVID in January, and I think I coughed for 3 weeks after I returned to work. So I would not consider like a dry, almost like a tickle in your throat, chronic kind of a cough, still having a symptom, because you'd never get back to work if that was the case. You know, I'm feeling more like a fever, body aches, chills, sore throat. You know, generally I really just do not feel well. I'm still, you know, fatigue is gonna hang on. Probably a dry cough is gonna hang on. Loss of taste and smell could hang on for a year. I know people who have been a year out and still struggle with that. So those things I would not consider still a symptom. Those are side effects to me from having COVID, because those can hang on for a long period of time.
Thank you. Just to add on to Stacy's comment about isolation. So for us, for our county policy, if you ended up in isolation because you tested positive, that would fall under our sick leave usage. So our employees could use sick leave to stay home during that isolation. They might also have a telework availability. Some of our staff do, some do not. If you're a corrections officer, you don't have the option to work from home. If you work in the license department, people aren't coming to your house to get their driver's license. Like you have to be in person. So some people utilize sick leave for that time, and some people are able to telework. So that's just going to depend on your industry and your office and what you have going on in your own business.
Yep. You want to go to the next slide, Steph? Okay. So quarantine. Quarantine is you know, it's kind of an odd word to use now, because if you are exposed to someone with COVID, you don't necessarily go into quarantine as far as staying home. That guidance has completely changed. So if you have had a known exposure to someone who has had COVID, so like a known close contact would be, say I was up in Lisa's office on Monday and she was coughing and felt rotten and this and that, and we were in her office for more than 15 minutes together, closer than 6 feet, spent time together in her enclosed office, and Tuesday she messages me and says, hey, just to let you know, I tested positive for COVID this morning. That would be considered a close contact. So now I've had a known close contact with someone with COVID. So now you go into the quarantine the quarantine part of COVID, but it's not quarantine how it was before. I don't go home and stay at home anymore. Doesn't matter if I've been vaccinated or not. I can still come to work. The day of my close contact is day 0. So Monday, the day I was with her, would be day 0. I should wear a mask for 10 days following that day 0 and monitor for any symptoms in that 10 days. If available, if you have the ability, we tell people they should test on day 6. And the reason for that is it takes time for a viral load to build up. So if I had exposure to her on a Monday and she called me on Tuesday and said, hey, I had COVID, and then I'm like, oh, okay, well, I'm going to test tonight, it's most likely going to show up negative. You know, you have to have time to build a viral load. So we say test after day 6. So say at day 6 you test and you're positive. Now you got to put yourself into the isolation section of COVID. So now you're sick, now you're tested positive, now you have to go into isolation. So with quarantine, it's just if you've had a close contact, you want to wear a well-fitting mask for those 10 days, monitor for symptoms. So at any time in those, so even if I tested at day 6 and it was negative and I'm still wearing my mask, maybe at day 8, all of a sudden I get a fever and I'm feeling really rotten. I'm going to want to test then at that point, because now I've developed symptoms and it could be positive. You can go to the next slide, Steph.
Stacy, before you go further, do you, if somebody calls public health and says they test positive, do you still do contact tracing to find out who they were around?
We do not. We leave that up to the individual. You know, we just tell them, you know, what like say they tested on Monday. They said, okay, I tested positive on Monday. We'll tell them, well, you need to contact everybody in the last 2 days that you were with, that you may have had close contact with, and just let them know. And that's up to them. I mean, whether they do or don't, and that's again where you fall into the problem of so many people passing it, because someone maybe didn't tell somebody, and then that person 5 days later got sick but didn't know it, and then they've already been with 6 other people. So
Right.
um,
So
and again, I just want to reiterate, we really need to get away from this whole fear of, if I've had COVID, oh my gosh, I don't want people to know I've had COVID, or I don't want to tell people, or it's everywhere. It is literally everywhere. So when I have people who, say to me, I got COVID, and they're like, I just don't know where I got it. I'm like, well, you can pick it up. I mean, pretty much anywhere you go. It would be really hard unless you were like, oh yeah, I went to the Renaissance Festival, I was at the Twins game, and I was here, and with very large groups of people. But some people are like, I have really no idea. I mean, you could have been around 2 people, and one of them had symptoms when they were with you, and you didn't really know it, and the next thing you know, you're sick. So
yeah. For us, again, from our employer perspective for Renville County, we don't contract trace anymore either. So if somebody tells us they have COVID, we say pretty much thanks for letting us know. See you in 5 days.
Right.
But we don't follow up with people. They may have been around. We leave that up to the employee themselves.
Actually, the Minnesota Department of Health doesn't do contact tracing anymore either. That used to be really big when COVID first came out. I mean, we were even involved in that, but they don't even do that anymore either. And just on a side note, we don't even keep track. I mean, more of what we do with numbers now is not like we have this many people ill in the county, we have this many people. Now it's more based on, are we in a high priority county right now? Are we low priority? And that's just based on information we know. We don't even know a lot of who is sick and who's not, because people do home tests, and they are not required to report that to the Minnesota Department of Health. So the numbers are very skewed. If people are really a numbers person, that's pretty skewed.
So, quick question. So if I would test positive for COVID right now, do I have to tell anybody? Do I have to call the county, the public health, my doctor, anybody like that?
You wouldn't have to tell anybody if you didn't want to. It would just be common courtesy to tell people,
But no required reporting, any of that.
No.
So the numbers you hear in the media are probably way off just because,
Yes. So when you go to the hospital and get tested, like a lab test, those they will report to the state. Those get reported. But if you do a home test, that's up to you if you want to report it or not. That's not required. And so that's why the numbers are very, very skewed, because lots of people, do a home test and are positive, and they don't report that.
So Stacy, on that same line, I had somebody say to me they didn't want to use the home test that had an app connected to it, because then the app would report them. Do you have any feelings one way or another on that?
I don't. If the app reported it, it's just going to report it as a number. It's not gonna, no one's going to call them and question them or ask them anything. It's just going to probably report it as a number, and not even who they are. They're not going to probably get a call unless someone wants to make sure they're okay.
Okay. Very good. I see there's a question in the chat about, can an employer require an employee to get a COVID test? I think from our perspective, it would depend on the industry that you're in. So if you are working very closely, let's say you're a nursing home, a skilled nursing facility, you might require a negative COVID test to come back to work.
Okay, so in industries like nursing homes, it would be required. They do go off of like say they have so many individuals in their facility that test positive, they are then required to test all staff and all residents on a regular, they have a total algorithm routine basis that they have to do that, but that's a requirement for them in long-term care. Now, like us in public health, it's not required that we take a COVID test, but obviously because of the individuals that we work with, we would take a COVID test. I'm not gonna put my 80, 90-year-old home care clients at risk of severe illness because I may have COVID and I didn't test for it. So it's not like we would be forced to, but just given the clientele that we visit, you know, we would test just to make sure that we, you know, okay, for instance, I had COVID back in January, and then I had a really bad cold in July, and I ended up testing myself 3 times before I'd go out on any visits, because, you know, I don't want to bring that to somebody who's compromised. Which brings to this slide here. You know, you always want to avoid individuals in settings where people are at high risk for severe disease. You know, if you are even in that quarantine period, you know, you just don't want to be around individuals that could be at high risk. You don't want to get them ill. And certainly when COVID was really bad, I worried about getting one of my home care clients so ill that they would end up in the hospital and could die. You know, we're moved beyond that, but you know, you just have to really be mindful in your work setting of who's our clientele, how much face-to-face do we have with people, am I able to work remote, am I able to work in an office with closed doors. And that goes with, like, not so much with isolation. I mean, if someone is positive for COVID, they really do need to stay home. They need to stay home for those 5 days. After those 5 days, if they're feeling better, you know, return to work with masks on. But if someone has been exposed, you know, if you have the ability to maybe remote work, maybe you want to do that. I know, like in public health, if I was exposed, then I would maybe try to rearrange some of my face-to-face visits just to decrease the chance that if I developed symptoms and got sick, I wasn't with my 90-year-old client the day before, and now I've exposed them and potentially could get them very ill. You know, it's just every workplace setting is unique. So you really have to think about, you know, this would be our best practice. This would be the guidance we would give. You know, depending on workplace settings, you might have some uniqueness, like Lisa said, you know, maybe you can remote work. You know, maybe you have the ability to be in your office with your door closed and you don't even, you know, see anybody. Maybe you work for the highway department and you're in a truck all by yourself all day. You know, during the high time of COVID, we dealt with a lot of that. We dealt with because way back, the guidance was if you were exposed to somebody, you were home. It didn't matter if you were vaccinated or not, or, well, that was way before vaccines, you were home. Did not matter if you had symptoms or nothing, you were home for that period of time, just sitting there waiting to see if you were going to develop any symptoms. And so we had to work with people on uniqueness. You know, if you're out in a truck all on your own, driving around, absolutely nobody is with you, then it's probably okay to be driving around on the truck by yourself and not, you know, not needing to stay at home for 10 days. And of course, every workplace is individual too. You know, some places might say, we need you to be ill, like you're feeling rotten, but, you know, we may need you to be here. You need to wear a mask. We're gonna, you know, put you here or wherever. So there's no like mandates as far as businesses, like you have to do this, you have to do this. This would just be our best practice. This would be the guidance we would give. This would be the best practice to follow in order that you don't wipe out your entire office, you know, with COVID. And everybody feels different. I've had people that are down for the count. I've had people who have said, well, I only had a stuffy nose. I thought I had allergies. I've had people who've said, well, all I did was sneeze. So it's really hard, you know, we don't have people who typically test if they have like a slight runny nose or some sneezing. You know, most people who test have a fever, aches, body chills. I mean, they really do feel pretty rotten with having COVID.
Just another thought on.
Go ahead.
Go ahead, Sarah or Stacy.
Well, I was just going to say on that second point on the slide, you know, as far as like people being ill with COVID, we have a lot of different treatments now. I always tell people, talk to your healthcare provider, especially if you're high risk for getting ill. Some of the treatments, other like Paxlovid, you know, that's an antiviral med. It shows that it does pretty well with people over 65, but it doesn't have as good results for people like 40 to 65. So we just really reiterate people to talk to their healthcare provider. You know, they'll best know like what treatment is available, and it's all about timing too. You know, if I had COVID and then a week later I called my provider and said, geez, I tested positive last week and I'm still kind of feeling pretty bad, they might say, well, you're way out of the window period to get any kind of treatment. You're just going to have to treat the symptoms. So if you are high risk, or if you live with high risk people, we really recommend that you talk with your healthcare provider just to see if there's any options for treatment available.
The other piece I was going to add from the employer side about the question back to, can you require somebody to get a COVID test? So in our policy, our personnel policy, we say that we could require a doctor's note at any time. So if you're off of work, we could ask for a doctor's note before you came back. So we kind of have the flexibility to do that if we want, but we don't have to. So again, I guess you'd probably want to look at your own policies to see if you have any language about that, about asking for doctor's notes. During high COVID, we did have some people that we required them to bring a negative COVID test before they could come back. Just again, because of the work situation they were in, but not all.
Right, and that practice has kind of fallen by the wayside as well. Partly because you could still have some virus in you, but not necessarily be shedding virus. So, it could be a month before you have a negative test, but yet you're feeling well. So a lot of that has gone kind of by the wayside as far as you have to have a negative test before you can come back to work. When COVID was, when we didn't really know what we were dealing with or anything like that, yes, that was very much a practice, but that has really kind of gone by the wayside. That would really be work specific, whether your work wanted that or not, but it's not a guidance that we tell people you have to do.
So you talk about COVID tests. The state of Minnesota has free COVID tests available at the moment.
Yes. If you go to my next slide, Steph, I think.
Sorry, didn't mean to jump the gun on you, Stacy.
No. Steph made my slides look so pretty. Yeah. Yep. So there is information. So the minnesota.gov/COVID-19, that gives you information on vaccinations, ordering home tests, and it also has a section there on business information. So if you go to that page and you scroll down like to the bottom right, there is a whole section for business information too for individuals if they want to look at that. And the site on there is really interesting because if you go on there, they have like you can find a vaccine, but I believe they also have link in there you can click into, and you basically put in your age and if you've had a vaccine before, and it'll tell you which vaccine you're due for next. So it really kind of helps in that way. Also, if you go to our Renville County Public Health page, about in the middle of the page we have COVID-19 information, and there's a link there too that you can click into, and it's like basically you put in information and it tells you nope, you're not eligible for this booster or whatever, or yes, you're eligible, or this is where you're at, what you're eligible for next. So of course I'm going to put a plug in there for the bivalent booster vaccine, which has just come out. Anybody is the bivalent Moderna vaccine is available to anybody 18 years and older, as long as they have had their primary series, meaning they've had their first and second dose of the Moderna, or possibly a third dose if you were immunocompromised. And you have to be 2 months past that last vaccine. You could have also had your primary series, so your first and second dose. Maybe you've had first and second boosters, so you have to have had that primary series finished and 2 months past the last vaccination. And the Pfizer is 12 and older for the bivalent. We've had a lot of confusion about this because people have said, I already got my booster shot. Well, that would have been the monovalent booster. This is a bivalent booster, so it's similar to like when you get your flu shot every fall. They determine what strain of the flu they're trying to target, and that's how they develop the flu vaccine. So the bivalent COVID booster now is more targeted to the Omicron variant. So if you've had your first and second doses of your Pfizer or Moderna, or even your first dose of J&J, and say you've had every booster you could get, this would be an additional booster. And I foresee the future that we are going to have to get similar to a flu shot, a COVID shot yearly, just so we don't have so many. We're always going to have waves, I feel, up and down of illness. But this is the hope that, you would not clog up the hospitals and we wouldn't have so many people dying and so many people severely ill from COVID. So, and we are running a walk-in clinic the first and third Fridays from 8 to 4 in our office. And our information on that is always on the Renville County website as well as on the Facebook page. So I just had to put my plug in there about booster shots. Another plug I'll put in there, because Jordan and I talked about this, is cleaning. We don't need to be crazy with cleaning. You don't need to wipe every surface down in your office. Washing your hands with soap and water is the best way to keep your hands clean. Hand sanitizer is good when you're in a pinch, in an area that you can't wash your hands with soap and water. I'm not a big, we don't need to wipe every surface with Clorox wipes after someone's touched it. I kind of gotten away from all of that crazy cleaning mode.
Stacy, when you're talking about the vaccination kits and the home test kits, can they get those from public health, or is their best bet going on this website and ordering them that way?
We do carry some test kits in our office. I just went on the website and ordered mine and got them within like 3 days. So it's really easy. I was able to order four test kits. Arrived probably 4 days after I ordered them. So, either way, if people have questions, they can always call. If we have test kits available, we do give them to individuals. If we don't, we do direct them where they could order them from or get them from. They also sell them at Walmarts and Targets, and I've seen them at the gas station. Wasn't like it used to be.
Yeah, so when it first came out, you could only order so many tests for your household per month or 6 months or whatever it was. So maybe some of us ordered a few and had on hand, and now those are expired.
Yeah.
Would you recommend I keep those to use if needed, or should I just get rid of those?
I would get rid of them. The issue with that would be is if you're feeling ill and you only have an expired test, so you decide to use it and it's negative, but yet you're feeling ill, I'd be a little like, is it negative or is it not? And test kits are so readily available that I would toss it and get it, order some new ones.
Hey Stacy, this is Stephanie. Is there any guidance on how long you should wait to get a booster after you tested positive for COVID?
Yes, thank you for asking that. The guidance is to wait 90 days post-infection. Mostly because you probably have viral load built up in you. It's not to say you can't get the booster. It's just that it may be more effective if you waited 90 days after you had just been ill with COVID. So it isn't to say if someone called me and said, well, I had COVID really bad 2 months ago. It's really up to you. I would say we would recommend waiting 90 days. It's not that you can't come and get your booster. You could. But the guidance would say wait 90 days.
Thank you.
And how long in between boosters?
Meaning?
So I got a booster on January 1st. How often should I be getting them to keep, or how long is the booster?
Well, okay. So when vaccinations first came out, you got your primary series. So you got, your first and second doses of Moderna, or first and second dose of Pfizer, or your single dose of Johnson & Johnson. And then when the boosters came out, we had a whole, I think it was like 4 months you had to wait to get that first booster. And then, see how bad my math memory is? And then you had to wait a period of time to get that second booster. Now the bivalent booster is really the only booster out there now. So if you didn't get any of the boosters and it's been 2 months since that last shot, you can get the bivalent booster. We have got no literature on what the plan is after the bivalent booster. Where are we going to go going forward from here? And that's for individuals who are 18 and older for Moderna, 12 and older for Pfizer. The young kids that are eligible for vaccinations, they have a little bit different series right now because many of them are still waiting to get that initial booster, and that would actually be the monovalent booster because they aren't okayed yet for the bivalent booster. So the bivalent booster is for older individuals who have finished that primary series. And you could get it even if you didn't even get that first and second booster, then that would be your booster. And then from here, we are not sure what are we going to have to get another booster in the spring, or are we looking at next fall, just like flu vaccine? We wouldn't do it again until another year if you've had yours already.
So another question, if
Stay
I could.
tuned on that, Jordan. Stay tuned.
Okay, thank you. Another question, if I can. So a inoculation, a booster, a COVID shot does not prevent you from getting the virus?
No, it's not gonna. The vaccines were never designed to eradicate COVID. The whole point of the vaccine is to lessen the symptoms, similar to the flu vaccine. You know, you're still going to get influenza. You could still get COVID. I mean, I had both of my vaccines and my booster and had gotten COVID. However, I just felt a little rotten. I didn't end up on a ventilator or 6 feet under. So that's really the whole goal, is to lessen the severity of the illness so that we don't have people clogging up ICUs to the point that, say, your grandma has a heart attack and there's no place for her at the inn because it's completely full. So no, it's not gonna eradicate it. It's just to lessen the symptoms, hopefully lessen the spread, and people recover more quickly.
Just to add on, when employees do get very sick, some options for you on the employer side. So like I said, our policy would allow people to use their sick time. If they were severely sick, we also, because we're a FMLA qualifying entity, they could qualify for FMLA. That would protect their job and their benefits going forward. They might qualify for short-term disability. I mean, if they were on a ventilator, that's a pretty severe thing. So there might be some other options to protect that employee and to protect their job and their pay if they were severely ill and out for a while. So I would just encourage you as an employer to check your policies and see what other things that person may qualify for. Just because if you have good people, you don't want to lose them, and you want to protect their job and make that part of life something they don't have to worry as much about while they're trying to get better.
And that's a really good point, Lisa, because I think a lot of people don't get tested or don't say anything because of the you know, I can't miss work, I can't not have my paycheck, I can't, and I totally understand that. So, you know, that is something as businesses to, you know, really think about. You know, if you're able to look at that, because I think that is one of the deterrents for people getting tested or staying home, or, you know, not wanting to know if they have COVID, because then they are out for that period of time. And let's be honest, people can't afford to be out of work if they aren't getting paid.
I was going to ask another question. Is it common, or is it advised, and maybe this is more towards Lisa, for businesses to kind of have kind of a COVID plan? Here's what happens if somebody comes down, and maybe update that periodically. I was talking with a banker outside of Renville County 2-3 weeks ago, and they said, yeah, one of our branches, we had a little outbreak. So we kind of shut it down. We closed the doors, locked them up, put a sign on, you know, on social media, on the front door, on our Facebook page, said, hey, our XYZ branch is closed, but please come over to one of the other locations. Is that kind of advised, like the ounce of prevention is worth a pound of cure kind of thing?
Right. So we're fortunate in that we have emergency management in the county, and they have thought through a lot of those, how to have that plan ready, what do they call it? The COOP?
Yes.
Continuation of operations?
Yes. Yep.
Yeah. So to have some sort of COOP plan on what your continuation is going to look like. So part of ours might have been, what if everyone in the jail ends up with COVID and can't come in? What are we going to do with the inmates? Because we can't just not be there. Somebody has to be there. What happens if everyone in the license department gets COVID? Can we shut that down and direct people to other locations? Yes. So each of those departments, or even units within a bigger department, might look a little different, but it would be good for you to have an idea of what that would look like in that situation.
We, like in public health, we had plans of, you know, do we have to hold referrals? Can we not? But we for each other. What services are essential? You know, what can we not provide, and what do we just need to provide to get us through that period of time? Good things to think about. I know some people maybe are thinking, well, we work in a really small office. It's still maybe a good idea to have kind of a plan.
And I believe the state of Minnesota, I don't want to say had templates, but had some ideas as you work up your plan. And I mean, it doesn't have to be formal, it doesn't have to be fancy, but some bullet points. Oh, if Lisa's sick, who's in command? What do we, that kind of stuff.
Yes.
And the state's got some that you can take a look at and kind of steal the best ideas from. If you can't find them online, let me know and we can help you dig them out too. But so that's available as well. Thank you.
I would say it's a good reminder for all of us to also kind of have a draft of, if I'm gone, here's the standard operating procedure for getting a new hire into the payroll system, getting them into the benefit system. Have that written out so somebody could open up your file and go through it and be able to continue those steps for you. Especially
yeah, we went through some learning curves initially of individuals who only did certain things, and we were going along. We were so focused on just the care of our clients, didn't think sometimes about, oh my gosh, what are we going to do if so-and-so goes down in the office? Like, who's going to look up all of our X, Y, and Z? Just who's going to look up all of the authorizations, or who's going to do the billing, or who's going to do, some things it was like, oh no, so-and-so's down for the count. Oh no. My hope is that we are beyond that extreme phase of COVID. Now we're sort of in, how do we live with this day to day? What do we do again if someone calls in and they said they've tested positive? Let's not panic. Let's just process it. Let's think about it. Things like that.
Right, and even with that continuous operations or a standard operating procedure, it doesn't have to be COVID. It could be that they broke their leg and they can't get to work for 3 weeks, or, I mean, who knows? There's a magnitude of things that could happen.
Right.
It could keep somebody away from work.
Just on a completely different, not a totally side note of this, but when I first started in public health, we were preparing for a pandemic flu, and I thought in my mind, this is the craziest thing. I'm never going to see pandemic flu while I'm here, Well, yeah, here we are.
Okay, that was the other question I was going to ask you. Is this still considered a pandemic, and are we still in a public health emergency?
We are still in a public health emergency, I believe until January, if I remember correctly. It is still considered a pandemic. They haven't declared it endemic. Endemic would be, it's here to stay, but we are living with it. We're not in and when it gets declared an endemic, I do see hopefully the public health emergency will end, which that too will have its own concerns, because many programs will then end for individuals. So, and I don't know how that may affect some businesses, but it possibly could. A lot of programs got put on hold and people remain eligible for many things because we're in a public health emergency, and a lot of that will then end. So that we will see a lot of changes with that.
So kind of playing off that, and I know you don't have a crystal ball, but kind of looking at what happened last fall, are you kind of thinking, kind of like with the flu, that as people are spending more time inside, that we may see a little bit of an uptick?
I do anticipate that, and I'm curious to see what happens with influenza as well. We'll get a combination of the two together. And of course you factor in school and all of that, people stuck inside with each other, spreading their germs to each other. And that would be the typical wave that you would see, the ebb and flow. COVID kind of its own uniqueness, but I would anticipate we will see some higher numbers come this fall. Maybe more severe illness, maybe the combination of influenza and COVID together, people being sick with both. It's hard to predict. I think, sometimes we think one thing and then it's like, whoa, we didn't see that coming. But I would say I would not be shocked if that's what we see this fall.
Sorry, don't want to be dominating the conversation. Other questions from other folks?
And no question is a dumb question. I tell you, people call us every day about just anything, you know, what do we do about this? What do we do about that? I cannot tell you anything about COVID in the deer population, although I have had a call on that.
So kind of the nuts and bolts, maybe kind of towards wrapping up, the best pieces of advice. I'm assuming what? Wash your hands on a regular basis.
Stay home if you're ill. Stay home if you are not feeling well. If you have symptoms of COVID, get tested. That's probably the best way to not spread it to everybody else, is to know what you have. It's difficult to treat what you don't know. It's a lot easier to treat something or deal with it if you know what you're dealing with.
I think it's better now, but for a while, I think there was also a lot of anger at certain industries for maybe taking it more serious than in, you know, other businesses. So I guess it just goes back to being respectful to each other, and, you know, we're each fighting our own thing and have different regulations. For us, public health also falls under Medicare regulations, which is different than public health maybe in another county. So we maybe have to follow some different regulations there. And then right across the hall, they're not part of Medicare, even in our own building, so they don't have to follow that. So that sometimes can lead to some interesting discussions.
Well, and some things are, you're exactly right, Lisa, some things are not determined by us. It's determined by our funding source maybe, or it's determined by some other entity, you know, that we have to follow. And we are, you know, dealing with, I mean, at the beginning of COVID, we were dealing with something none of us really even knew what we were dealing with. So it was a lot of flying by the seat of our pants, and that's why things changed so much, just based on what we learned throughout treatment and throughout the whole initial pandemic period.
Just a final note, I don't know, Stacy, if you were going to share it or if we're just going to send it out, but your guidance piece on when to isolate versus quarantine. So public health has done a fantastic job of updating that throughout the 2.5 years. And at some points there was like 30 boxes that you had to work through. Now it's just 2 lines and it's nice and simple. But we share that all the time with staff and with supervisors when they're wondering what to do in this situation or this situation. So it's a great piece if that's something that's helpful for other businesses.
Yep, and Jordan, I think Jordan was going to email that out. We do not put that on our website because, you know, we'd be constantly in the website trying to fix things, but we keep it in our office. And so certainly if you want it in the future or whatever, you can email our email there that's up on the screen, and we would easily be able to just shoot it out to you in an email. And then if we always, you know, anytime you hear in the news CDC's changing their guidance on isolation and quarantine, we're always kind of waiting, and once we get final word after it's been adopted by the Minnesota Department of Health, then we go in and update our. So if you have the guidance and you're hearing that in the news and you're wondering if it has changed, you can always contact us, because once we have it updated, we can certainly send out the most current one. At some point in life, we would love to not have one, like, woo, you know, like we don't, just stay home. You don't feel well, stay home.
Gotcha. Any questions in the box? Any messages or anything?
Angie, I totally agree with you. Thank you to Public Health, because the amount of times I've had to call them and our staff have called them, and I can guarantee people from around the county have called, is fantastic service.
Hey, we're happy to help.
Last call for questions. All right.
And if you have a question that you don't want to ask here online, you can always put it in that email, and it will get routed to somebody, and they will get back to you.
Awesome. Awesome. Well, thank you so much, Stacy Larson from Renville County Public Health, Lisa Nikens, our HR director here at Renville County. Thank you so much, ladies. Appreciate it. And again, businesses, if there's anything we can do or you have any questions, feel free to reach out to Public Health. The number and the email for the generic mailbox is there for that. And if there's anything we can do for Renville County businesses, feel free to give me a call. Again, we'll be sending that information out. We taped this today. We'll be putting that link out too for those that may have missed it or you want to watch it again or that kind of stuff. We'll make that available. And again, thank you on behalf of Renville County, all our businesses. Have a great day, and we'll see you next month on Renville County Lunch and Learn. Thank you.
Thanks, Jordan.
Bye-bye.